What are the different types of colon polyps? Imagine your colon as a long, winding tube that helps process waste and absorb nutrients. Sometimes, small growths called polyps can form on the inside lining of this tube. Understanding the different types of colon polyps is key to maintaining colorectal health and preventing cancer. Broadly, colon polyps fall into two main groups based on their potential to turn into cancer and their microscopic features. The first group is called non-neoplastic polyps. These are usually harmless and rarely become cancerous. Common types include hyperplastic polyps, which are small and often found in the lower part of the colon and rectum. They have a very low chance of turning into cancer. Inflammatory polyps tend to appear in people with inflammatory bowel diseases like Crohn's disease or ulcerative colitis. While these polyps themselves are not cancerous, their presence indicates ongoing inflammation, which can increase the overall risk of colorectal cancer. Then there are hamartomatous polyps, which are made of normal tissue arranged in an abnormal way. For example, juvenile polyps in children are usually benign, but when multiple hamartomatous polyps are seen in syndromes like juvenile polyposis or Peutz-Jeghers syndrome, the risk of cancer can be higher. Cowden syndrome also involves hamartomatous polyps linked to increased cancer risk. The second group is called neoplastic polyps, which are considered precancerous. These have the potential to develop into colorectal cancer if left untreated. The most common precancerous polyps are adenomatous polyps or adenomas, making up about 70% of all colon polyps. Adenomas come in different types based on their microscopic structure. Tubular adenomas are small, tube-shaped glands and are the most common, usually carrying a lower risk of turning into cancer. Villous adenomas are larger, with finger-like projections, and have a higher chance of becoming malignant. Tubulovillous adenomas are a mix of both features and carry an intermediate risk. Then there are sessile serrated adenomas or polyps, which are flat or slightly raised with a sawtooth pattern under the microscope. These are often found in the right side of the colon and can be precancerous. Less common are traditional serrated adenomas, which also have precancerous potential and distinct microscopic features. In addition to these types, the shape and appearance of polyps matter for doctors. Pedunculated polyps are attached to the colon wall by a stalk, making them easier to remove. Sessile polyps are broad-based and flat or slightly raised, which can make them trickier to detect and remove. Flat or depressed polyps are less common but may have a higher risk of becoming cancerous. Medical endoscopic systems like the NICE system help doctors analyze polyps based on their color, surface, and blood vessel patterns to predict their nature and malignancy risk. In summary, colon polyps are diverse, ranging from harmless hyperplastic polyps to precancerous adenomas and serrated polyps that requiring removal and ongoing surveillance. Regular screening, especially colonoscopies, helps detect and remove these growths early, greatly reducing the risk of colorectal cancer. Always consult healthcare professionals for personalized advice and management to keep your colon healthy and safe.